If you take amlodipine every day, there is something important you need to understand. Taking the medication exactly as prescribed is essential, but swallowing the tablet is only one part of managing your blood pressure safely. The pain relievers you use, the supplements on your kitchen counter, the food you eat, the alcohol you drink, and even the symptoms you choose to ignore can all influence how you feel and how well your treatment works. Most medication-related problems do not begin with a dramatic warning. They often appear as ordinary changes that are easy to blame on age. You may feel slightly dizzy when you stand up. Your ankles may become swollen toward the end of the day. Your blood pressure readings may suddenly become less predictable. You may feel unusually tired, weak, or unsteady without understanding why. These symptoms do not always mean something serious is happening, but they should not be dismissed automatically. Sometimes they are your body's way of telling you that your medication routine needs to be reviewed. Amlodipine is commonly prescribed to help control high blood pressure and reduce the workload placed on the heart. It works by relaxing and widening blood vessels, allowing blood to move through them more easily. For many people, it is effective and well tolerated. The goal is not to make you afraid of taking it. The goal is to help you recognize the everyday habits and combinations that may create unnecessary problems. Before we go any further, remember this clearly. Never stop taking amlodipine, change your dose, or alter your schedule without speaking with the healthcare professional who prescribed it. Feeling well does not mean your high blood pressure has disappeared. In many cases, feeling well means the medication is doing exactly what it was intended to do. One of the most common problems I see is regular use of over-the-counter pain medication without considering its effect on blood pressure. When arthritis flares up or back pain becomes uncomfortable, many people reach for ibuprofen or naproxen. These medicines are widely available, so it is easy to assume they are harmless. However, medicines in this group can cause the body to retain sodium and fluid. In some people, they may also raise blood pressure and place additional strain on the kidneys. This can make blood pressure more difficult to control, especially when these products are used frequently. That does not mean a person taking amlodipine can never use one of these pain relievers. The risk depends on your kidney function, heart health, dose, frequency of use, and other medications. The mistake is taking them repeatedly without discussing it with your doctor or pharmacist. Some people immediately switch to acetaminophen because they believe it is always the safer choice. It may be appropriate in certain situations, but it also has limitations. Liver disease, alcohol use, and other medicines containing acetaminophen can affect whether it is suitable for you. Instead of choosing a pain reliever based on habit, ask which option fits your personal medical history. Cold and sinus medicines deserve the same caution. Many combination products contain decongestants that tighten blood vessels. Ingredients such as pseudoephedrine may raise blood pressure, increase the heart rate, or cause restlessness and difficulty sleeping. The problem is that these ingredients are often hidden inside products marketed for several symptoms at once. A single package may contain a pain reliever, antihistamine, cough suppressant, and decongestant. Unless you read the label carefully, you may not realize that one ingredient could work against your blood pressure treatment. When you have a cold, tell the pharmacist that you take medication for high blood pressure before choosing a product. That brief conversation can prevent several days of elevated readings or unexplained discomfort. Another issue that is frequently overlooked is the use of vitamins and herbal supplements. Many people tell their doctor about prescription medicines but do not mention supplements because they do not consider them to be medication. Natural does not mean inactive. A plant, mineral, extract, or concentrated powder can still affect blood pressure, circulation, kidney function, or the way your body processes prescription drugs. Products containing magnesium, garlic extracts, beetroot, hawthorn CoQ10, or other ingredients are often promoted for heart health or circulation. Some may have a modest effect on blood pressure. Others may have limited evidence or may contain several active ingredients in one formula. The concern is not always that the supplement is dangerous by itself. The concern is that its effect may be added to the effect of amlodipine or another medication you take. In a sensitive person, that combination may contribute to dizziness, weakness, or blood pressure that falls lower than intended. Other herbal products can interfere with the enzymes responsible for processing medications. This may cause the level of a prescription drug to increase or decrease without any change in the dose written on the bottle. Keep a complete list of everything you use, including vitamins, herbal teas, powders, gummies, drops, and occasional supplements. Bring the containers to your pharmacist or medical appointment whenever possible. Your doctor cannot evaluate an interaction involving a product they do not know you are taking. Alcohol is another factor that may affect people differently after the age of 60. Amlodipine relaxes blood vessels, and alcohol can temporarily have a similar effect. When the two are combined, some people experience flushing, tiredness, dizziness, or unsteadiness. This matters because the consequences of a fall become more serious as we age. A small drop in blood pressure that once went unnoticed may now make you lose your balance when standing up, walking to the bathroom, or getting out of bed during the night. Alcohol can also interfere with sleep, hydration, and medication routines. Frequent or heavier drinking may make blood pressure more difficult to control over time. Some people notice that their readings are higher the morning after drinking, even though they took their medication as usual. Pay attention to what happens in your own body. Do you feel dizzy after an evening drink? Do you wake feeling dehydrated or unusually tired? Are your morning blood pressure readings different? These patterns are worth discussing with your doctor. Grapefruit also causes understandable confusion. It is generally considered a healthy food, but grapefruit and grapefruit juice can affect enzymes that process certain medicines. Not every blood pressure drug is affected in the same way, and the significance of the interaction can vary from person to person. Because recommendations may differ depending on your dose, your other medications, and how much grapefruit you consume, the safest approach is to ask your pharmacist directly. Do not assume that a small amount is always harmless, but do not become frightened of every type of citrus fruit either. Check flavored drinks and supplements as well. Grapefruit extract may be present in products that do not look like ordinary grapefruit juice. When you are uncertain, show the label to your pharmacist instead of trying to judge the interaction yourself. Consistency is also important when taking amlodipine. This medicine remains active in the body for a long time, which is why it is usually taken once each day. Small variations in timing may not cause an immediate problem, but repeatedly forgetting doses or taking the tablet at very different times can make your routine difficult to manage. The best time to take amlodipine is usually the time you can follow consistently and the time recommended by your prescriber. For some people, that is in the morning. For others, it may be later in the day. Your doctor may take your symptoms, blood pressure pattern, and other medications into account when advising you. Connect the dose with something you do every day, such as eating breakfast, brushing your teeth, or preparing for bed. A pill organizer or phone reminder can also help. If you forget a dose, do not automatically take 2 tablets the next time. Follow the instructions provided with your medicine or contact your pharmacist for guidance. Doubling a dose without medical advice can cause your blood pressure to fall too low and may increase dizziness or weakness. Diet can also make a noticeable difference, especially when it comes to sodium. Amlodipine helps relax blood vessels, but a high sodium diet encourages the body to retain fluid. That additional fluid can make blood pressure harder to control. Most people do not get the majority of their sodium from the salt shaker. It often comes from canned soups, frozen meals, deli meats, instant noodles, sauces, packaged snacks, pizza, restaurant food, cheese, and bread. A meal does not need to taste extremely salty to contain a large amount of sodium. This is why food labels are so useful. Look at the sodium number and the serving size together. A package may appear reasonable until you realize it contains 2 or 3 servings. You do not need to become anxious about every grain of salt. The goal is to identify the foods contributing the most sodium to your routine and reduce them gradually. Your ideal sodium intake may also depend on your kidney function, heart health, and other medical conditions, so ask your clinician what target is appropriate for you. Swollen ankles are another issue that should never be ignored completely. Ankle and lower leg swelling is a known side effect of amlodipine. It often becomes more noticeable later in the day, especially after sitting or standing for long periods. Your socks may leave deeper marks. Your shoes may feel tighter. Pressing the skin may leave an indentation that takes a few moments to disappear. Mild swelling is not always dangerous, but you should not assume that amlodipine is automatically the cause. Leg swelling can also be related to vein problems, heart conditions, kidney disease, infection, or a blood clot. The pattern provides important information. Gradual swelling in both ankles is different from sudden pain and swelling in one leg. Swelling accompanied by shortness of breath, chest discomfort, fainting, or rapid weight gain needs prompt medical attention. Tell your doctor if the swelling is persistent, worsening, painful, or interfering with walking. Do not borrow someone else's water pill, reduce your dose, or stop the medication on your own. Your healthcare provider may need to examine you, review your dose, or consider a different treatment strategy. Home blood pressure monitoring is valuable, but it can create problems when people react too quickly to one unusual number. Blood pressure naturally changes throughout the day. Stress, pain, caffeine, exercise, poor sleep, a full bladder, recent smoking, and even talking during the measurement can affect the reading. An incorrect cuff size or poor body position can also produce misleading results. Your back should be supported, your feet should rest flat on the floor, and your arms should be supported near heart level. The cuff should be placed on bare skin rather than over clothing. Sit quietly for several minutes before taking the measurement. If the first number is unexpected, wait briefly and repeat it. Record the readings instead of changing your medication immediately. Some people see a high reading and take an extra tablet. Others see a lower number and skip their next dose. Unless your doctor has given you a specific written plan, neither response is advisable. A pattern collected over several days usually tells your healthcare provider much more than one isolated number. Write down the time, the reading, any symptoms, and anything unusual that happened that day. However, do not ignore severe symptoms. A very high or very low reading accompanied by chest pain, severe shortness of breath, fainting, confusion, difficulty speaking, weakness on one side of the body, or a sudden intense headache requires urgent medical evaluation. One of the most important safety steps is making sure someone reviews all your prescriptions together. Many older adults receive medication from more than one doctor. A primary care physician may manage blood pressure, while another specialist treats pain, infection, sleep problems, anxiety, seizures, or a heart condition. Each medicine may be reasonable on its own, but problems can arise when no one sees the complete list. Certain antibiotics, antifungal medicines, heart rhythm drugs, seizure medications, and other prescriptions may affect how amlodipine is processed or add to its blood pressure lowering effect. This does not mean these medicines can never be taken together. It means the combination may require monitoring, a dose adjustment, or a different choice. Using one pharmacy for all your prescriptions can make interaction checks easier. Whenever you receive a new medicine, ask the pharmacist whether it interacts with amlodipine and whether you should monitor your blood pressure or watch for particular symptoms. Do not assume that every interaction will be caught automatically, especially if you use multiple pharmacies or receive prescriptions from several specialists. Keep your own updated medication list and carry it with you. Perhaps the most dangerous misunderstanding is believing that you no longer need amlodipine because you feel well. High blood pressure is often silent. You can have dangerously elevated pressure without feeling any different. When the medication lowers your blood pressure successfully, you may feel exactly the same as you did before. That does not mean the medication is unnecessary. It may mean the treatment is protecting you without producing symptoms. Stopping amlodipine can allow your blood pressure to rise again, increasing the strain placed on your heart, brain, blood vessels, and kidneys. If side effects are troubling you, speak with your doctor. There may be ways to adjust the dose, change the timing, review another medication, or use a different treatment. If cost or a delayed refill is causing you to miss doses, contact your medical office or pharmacist before the medication runs out. Do not remain silent because you feel embarrassed. Financial and practical barriers are common, and solutions may be available. Amlodipine is not a medication you need to fear. For many people, it is an effective and reliable treatment. The real risk often comes from incomplete information, inconsistent use, or trying to solve medication problems alone. Your doctor needs to know if your ankles are swelling. Your pharmacist needs to know about the supplements you use. Your care team needs to know if you take ibuprofen several times a week, feel dizzy after drinking alcohol, or have noticed a change in your home blood pressure readings. At your next appointment, bring an accurate list of every prescription medicine, over-the-counter product, vitamin, herb, cream, drop, and occasional remedy you use. Include the dose and the time you normally take it. Ask whether every product is still necessary. Ask whether any combination may affect your blood pressure. Ask what you should do if you miss a dose. Ask which symptoms should lead you to call the office and which ones require urgent care. These questions are not a challenge to your doctor's authority. They are part of responsible healthcare. Managing blood pressure is not about achieving one perfect number every day. It is about reducing long-term strain on the body and lowering the risk of serious problems over time. Your daily habits, your medications, your diet, and your health conditions all work together. When one part of that system changes, the others may be affected. Take amlodipine exactly as prescribed. Keep your medication routine consistent. Pay attention to new symptoms. Keep an accurate record of everything you use, and make sure your healthcare team has the complete picture. You do not need to become your own doctor. You simply need to become an informed and honest partner in your care. That is one of the most effective ways to help your medication work properly, protect your independence, and support your health for the years ahead.